Thank you for joining us. We will now begin the event.
Hello and good evening. Thank you so much for joining us for the spring semester town hall for Vanderbilt University professional and graduate students. My name is Megan Mundy and I'm an assistant dean at Peabody, and I'm the assistant dean of student engagement and well-being. Today, I will be moderating this town hall and I'm really excited to be here. I'd like to start by introducing our panelists, and we have Bunmi Alatunji, the Gertrude Conway Professor of Psychology, an Associate Professor of the Graduate School, and also the Associate Dean of Academic Affairs for the Graduate School. We have Pam Jones, the Associate Vice Chancellor for Health and Wellness, and the co-leader of Vanderbilt University's Public Health Central Command Center. We have Jamie Hardy, the Assistant Director in the Office of Student Care Coordination, and Andre Churchwell, Vice Chancellor for Equity, Diversity, and Inclusion. We will be taking questions that were submitted in advance of the town hall during the Q&A session with each of our panelists. Additionally, we have enabled Zoom's question and answer feature during the town hall so that we can also take your live questions. I'd now like to welcome Associate Dean Bunmi Alatunji to say a few words.
Dr. Olatunji, sorry. You may need to unmute yourself.
Oh, yes, that would help things along, wouldn't it? Thank you, Megan, for that kind of introduction. Before I begin, I want to thank you for joining the town hall, and certainly each of you for doing your part to help keep our community safe during this time. I certainly know that you have many questions, and I hope that we can address most of those questions for you today. As we prepare for the spring semester, I really want to share with you our two guiding principles and also some data points from the fall that helped kind of shape our decision making here at the graduate school with regards to this particular semester. Now, with regards to the philosophy for this semester, essentially our guiding principles, the one thing I do want to communicate here is that Vanderbilt is deeply committed to continuing in-person learning. And with our graduate student experience being built upon collaboration and research, we certainly aim to continue this method for this particular semester. As a renowned research institution, it doesn't come as a surprise to you that, part of our responsibility is to provide students with a high level of scholarship, but more importantly, certainly we have a commitment to training you the next generation of scholars, researchers, and practitioners. Now, the second principle that we're focusing on here is that collaboration is really central to our work. The expansion of knowledge that interdisciplinary studies allow is much easier to accomplish when we can physically be together. And we will continue to do so with an abundance of caution, certainly to protect the most vulnerable amongst us. Now, this spring semester, we have faculty that are teaching well over 1,000 graduate and professional courses here on campus. And that's not including off-campus work, research, dissertations, and other immersion experiences. Now, these numbers suggest the capacity and demand for high levels of learning and engagement. We can also find reassurance in the fall 2021 data regarding the on-campus cases. For example, for the week of August 22nd to the week of December 12th, the percentage of unvaccinated individuals who tested positive for COVID only reached above 1%, the 1% mark 3 times. Now, this is in contrast to vaccinated community members from who positive tests never went above 0.6%. And in fact, the average was around 0.16%. Now, of course, we do expect these numbers to be higher this spring with the more contagious Omicron variant. Thankfully, recent studies show milder symptoms among vaccinated individuals. And Pam Jones will share more with you shortly about these trends and our new campus protocols. Now, I will say just a little bit about the new campus protocols and also speak a little bit about compliance. Now, we have delayed the start of class by 1 week. Spring classes will now begin the week of January 17th. Gratefully, with some creative scheduling, our colleagues in the registrar's office were able to adjust the spring calendar with no interruption to spring break, which we know is a crucial time for us to kind of take a break and refresh. I will also note that commencement will also remain as scheduled on May 13th. Now, one safety measure that we've put in place as we return to campus is the Commodore's care period. Until January 24th, all students are required to participate in this quiet period. So during this time, we're asking all activities that should take place virtually. We're also asking for students to essentially shelter in place and only engage in essential activities like attending classes, picking up food and supply, seeking medical care, or performing vital work or research for the university. Certainly, you can also engage in outdoor activities that do not involve close contact. I should note that we take the safety of all our community members quite seriously. The Office of Student Accountability has enhanced compliance efforts surrounding health and safety protocols. By each doing our part to follow safety guidelines, mask wearing, and physical distancing, we can protect ourselves, our family members, and those around us. It is crucial that everyone follow all safety protocols so that we can continue our mission of scholarship and research on campus together. I want to talk just a little bit about just personal responsibility and working together. Now at Vanderbilt, we have a deep commitment to community, not only as a community of scholars, but also as a community of individuals who value and care for each other. This ever-evolving pandemic has presented us with many challenges, including some that have affected our well-being and mental health. Please remember that there are many resources on campus that can support you during this complicated time. The Student Care Network is working to expand its virtual mental health and well-being appointment options and its availability for drop-in consultations. I'll also let Jamie Hardy share more about these campus resources and other online and self-directed tools in a few moments. In difficult and complex moments such as this, the value of your work is especially vital, and your impact in our community and on one another is all the more boundless. I really want to thank you for your flexibility and continued perseverance. And with that, Megan, I will turn it back to you.
Thank you so much, Associate Dean Alatunji. We appreciate your comments, and I would like to jump right in with some of the questions, which include questions that were submitted by our students, graduate and professional students. My first question for you from our students is that you spoke about changes to the protocols for spring semester. Can you tell us a little bit more about the reasoning behind pushing back the start of the spring semester for students and the reasoning for continuing some graduate program start dates as originally planned?
Yeah, that's a great question. You know, from the start, our approach to navigating this pandemic has been guided by science and the input of our team of health experts at Vanderbilt University Medical Center. Now, that continues to be the case as we plan for the spring semester while monitoring the most recent data that's available to us. As in many cities around the country, it is expected that we will see a higher number of COVID cases in the Nashville community in the weeks ahead due to this rapid spread of the Omicron variant. Now, the good news is that our campus is 96% vaccinated, and individuals who test positive may remain asymptomatic or have mild symptoms. But as I noted before, we must protect the most vulnerable in our community and the surrounding Nashville area. Now, we're also committed to continuing in-person learning, right? And we believe we can accomplish that by making health and safety a priority on campus. While we hope to make the Vanderbilt student experience as normal as possible under these difficult circumstances, we're certainly sensitive to the many challenges that the past 2 years have presented. Again, I would like to encourage you to make use of campus resources for mental health and well-being in particular, and also just to support each other the best we can.
Wonderful. Thank you so much. The next question is about ensuring that people are complying. And I know that you had mentioned the Office of Student Accountability. This question is, how are we going to ensure that people follow the university's COVID protocols and guidelines? And who do we get in touch with if we see the U community members that are not complying with the COVID policies, such as wearing masks indoors and perhaps not maintaining physical distancing?
Yeah, we really need to work together on this. We also need to hold each other accountable to the protocols in place. Now, as I mentioned earlier, the university is enhancing compliance efforts surrounding health and safety protocols. And any violations will be referred to the Office of Student Accountability, Community Standards, and Academic Integrity. And I should note that swift action will be taken for any verified incidents of noncompliance. Now, if you have a COVID-19 concern, you can report it by calling the Public Health Ambassador hotline, and that's at 615-343-1352.
Great, thank you so much. We appreciate your comments, and now we're going to turn it over to our next panelist for tonight. Pam Jones is our Associate Vice Chancellor for Health and Wellness, the Associate Professor in the School of Nursing, and the co-leader of Vanderbilt University's Public Health Central Command Center. Pam will talk about the latest COVID trends and what we currently know about the Omicron variant and our testing and contact tracing protocols for the spring semester. Pam?
Thank you so much, Megan, and I'm glad to be here tonight with this group of graduate and professional students. So I want to just talk through a couple of different things as we go through this and expand a bit on what my colleague has already said, which is, what do we know so far about Omicron? And I'm sure many of you have been in the literature and on the news and watched what's going on, but I'm going to hit some high points here. We definitely know that Omicron is more contagious than Delta or other previous variants. There's no question about that, and we're seeing evidence of that as our case up here. We know that vaccines and prior infections to other variants are less effective at preventing infection, but they be highly effective at preventing severe illness. And we also know that boosters are, when you're eligible, significantly increase your protection. The last I read, I believe with Pfizer, went from 35% protection with the 2 doses and up to 70% after a booster. So it's significant. We don't really know when we're going to peak either here or in other parts of the country. We are watching very carefully trends out of other countries such as South Africa and the UK to see what's happening there. If you've watched the trend line out of South Africa, they peaked very quickly and then came down very, very quickly. So we're hoping that's what's going to happen here. Most experts are predicting a peak here sometime in January, hopefully sooner rather than later. The good news in general, as already noted, is that Omicron appears to create much less disease burden than other variants. People have mild symptoms, and there appear to be less risk of hospitalization from this variant. But we still need to really focus on layers of protection. So distancing when we can, masking, and they're recommending KN95 masks to be more effective than masks with this particular variant. So let me touch briefly on our campus trends. We are definitely seeing increased cases. We knew we would, and we are. And those cases are being reported both on and off campus. So individuals who are still at home and have not come back are reporting those cases. I did a little deep dive into the data this morning. And since January 3rd, looked at what percentage of the cases group would be interested in graduate and professional students. And over 60% of the cases that have been reported for both on and off campus since January 3rd for student cases are in the graduate and professional schools. So you guys are at risk, and partially because you're out in the community a lot. And as we know, our community is less vaccinated than our campus community. So we are seeing spread in household contacts. We've always seen that, but we're also seeing a little more spread in friends groups and sort of business, work connections where people eat lunch together a lot. So we're seeing a little evidence that it is more contagious than Delta. Asymptomatic testing program, we're seeing an 8% positivity rate, and that's pretty consistent over the past week or so. That compares to, as already noted, about less than 1% prior year with the Delta variant. So it's real, and we're watching these trends really carefully and that's all in trying to make those decisions. So contact tracing is still up and running, as are all the command center functions, and many of you are familiar with that. We implemented a partially automated process for that. So we're going to be pushing out surveys to streamline the process, both for you as you participate in it, as well as for the contact tracers in the command center, so we can process these cases quickly and efficiently. We've implemented the new CDC recommendations that reduce isolation to 5 days, assuming symptoms are improving, and there's no fever without medication, fever reducing medications, followed by an additional 5 days of wearing a tight-fitting mask. So this really decreases the burden of isolation if you're positive. The testing program is changing. We've enhanced the testing program for this semester. And as many of you know, because you've already done it, testing was required before you return to campus or return to campus. For the spring, we're going to be testing 2 times a week those individuals who do not have proof of full vaccination, 1 time a week for individuals fully vaccinated, but booster eligible and who do not provide proof of a booster. And then our Sentinel Testing program, which is an ongoing program where we sample a small segment of the population to give us a feel for what's going on campus. And we'll be implementing that in a week or so. Symptomatic testing continues to be available through student health and other community resources. This is really important because many communities are having testing shortages, and we're very fortunate to have those assets here from to be able to care for our population. And just a reminder that you're exempt from any testing for 90 days after being positive. So don't present for testing if you've already been positive within 90 days. So final messages for me, please get your booster. It's the best way to protect yourself and those around you. And we know how frustrating this is. We're all really tired of it, but we've just got to hang in there to get through this surge, try to see what COVID in the future do, and try to take best care of each other. So thanks, Megan. I'll stop there.
Wonderful. Thank you so much, Pam. It was really helpful to hear some of those details and learn more about what Omicron is looking like on campus. We do have a couple follow-up questions as well for you. And the first one is that some students have expressed concerns about being able to find a COVID test to submit for the return to campus testing before arriving back on campus. Can you talk through what their different options are?
Sure, and that is a very legitimate concern in some communities. So first, I would suggest you look into your own community, your health departments, and what assets are there that you could take advantage of. But if you can't find a test, then you can present at our testing center when you arrive on campus and get tested.
Super. And then what is Vanderbilt's plan if we were to experience a major outbreak or an influx of new cases? What is Vanderbilt thinking might happen then?
Well, we're watching this very, very closely, as you might imagine, and we've got a number of contingency plans. We feel like we're fairly well positioned right now because we still, again, have contact tracing and command center all set up to manage this. We'll be working with senior leadership should we see trends that are higher than we expect. We do expect high cases. The question is, do they reach a point where they tip us over from being unable to do in person? And that's why we're being so cautious with the Commodore CARES period, because we really don't want to get to that point. We value so much that in-person learning that we are able to provide here. So we've got contingency plans. We've run a number of different scenarios, and we're ready and watching that data.
Wonderful. And the magic question, looking ahead to once Omicron has passed, what kinds of metrics and endpoints are being used to determine when the masking requirements and other restrictions will be more relaxed on campus?
So we are going to be watching everything. We watch data out of other countries. We watch data in other regions. We watch the CDC data points around county level and state level and country level transmission. We watch our own trends here of case counts. We also watch really carefully what's going on with our healthcare system, because one of the points is, although the majority population would not become very ill with this Omicron variant. We don't want to overwhelm our healthcare system. And so we watch hospitalizations, and mortality rate, unfortunately, is something else that we watch really closely. So we'll watch all of that. We do a balanced scorecard, if you will, to make decisions. And then what is the CDC and the Tennessee Department of Health recommending? We've always been pretty consistent with applying all of the recommendations.
Great. Thank you so much. You are working hard over there in the command center. We know. We appreciate all you're doing. So now we're going to welcome Assistant Director from the Office of Student Care Coordination, Jamie Hardy. Good evening, Jamie. Good to see you here. And my first question for you is, we're now going on almost 2 years since the pandemic began and the effects of it on students' mental health and well-being. Can you tell us a little bit about how the university is working to support our students through various support services and resources?
Absolutely. Thanks so much for moderating our discussion tonight and for that question. So I want to start by saying that we are well aware that mental health and well-being has been significantly impacted by the pandemic, as well as some of the protocols that are in the best interest of keeping our physical health in the way in which that we would hope for it to go. The number of appointments of scheduled mental health appointments within our university has increased by 16%. And so while that may seem like a small number, 16% kind of equates to 1,300 appointments in which we have increased over the past 2 years. So we're well aware of that. And with that, there are a number of efforts that the entire student care network is undertaking to address that need. Starting with expanding our team of providers across those primary offices of the student care network. So that's the University Counseling Center, the Center for Student Wellbeing, the Office of Student Care Coordination, and the Student Health Center. We have and will continue to hire additional medical professionals, psychologists, counselors, coaches, psychiatrists, and care coordinators to provide increased availability and support and care. And with that, we've been able to recruit diverse staff with different backgrounds and identities, and have also been able to enhance cultural competency training for all of the service providers as well as support staff, and expanded specialized care options for marginalized student communities. We've maintained both in-person and virtual appointments and have expanded drop-in services. So now all of the primary offices within the student care network have both scheduled and drop-in appointments to ensure that students are able to connect with support in a way that feels most comfortable for them. Our staffing expansions have also allowed us to provide satellite services for students with specific identities, especially where challenges may have been exacerbated by the current pandemic, as well as within specific schools across Vanderbilt, especially in some of our graduate programs. Students can visit the websites of individual offices or the satellite services tab on the Student Care Network website for that updated information. And then as far as some specific resources that students have access to, so new this year is Academic Live Care, which is a 24/7 telehealth platform for students to have access to both physical and behavioral health providers. So in reality, that looks like psychiatrists, therapists, and nutrition consultants as well. And for those who would like it, there's also lactation consulting on there as well. So given the uptick in demand for telehealth and mental health resources, that is an opportunity for us to supplement what is offered at the university through the Student Care Network. Also, there are evening and weekend appointments that are available through that service, which the current University Counseling Center isn't able to accommodate. So the Office of Student Care Coordination is available to help students understand where the best place of support may be. But we also want to always encourage students to take an active approach in regard to their well-being. So on the Student Care Network website, there is a resources tab, and then the self-directed tools tab. And so there, students will be able to find things like meditation from the Headspace app, the My SSP app or My Student Support Program. And that's for international students who would prefer to receive help in a language that is not English. And then also the Office of Student Care Coordination offers Seeking Help Off Campus, an opportunity to look at different ways that you can find support in the community. There are a number of other things that the Student Care Network is doing within itself, like incorporating student feedback. We've also had a number of outreach programs where we've been in the Vanderbilt community and created some new initiatives within our staff to just better support our students. So I'll end with encouraging students to follow us on Instagram. We have worked very hard to merge those accounts. You can follow us at Vandy Care Network. Not only is it aesthetically pleasing, but we really do have some updated information there. And also the Student Health Center is at Vandy Student Health.
Great, Jamie. Thank you so much. I follow you all on Instagram and I agree. It is attractive and it is great information. So thanks for all those great resources and all the efforts that the Student Care Network is undertaking to support our students and our Vanderbilt community at this time. Our next panelist is Vice Chancellor for Equity, Diversity, and Inclusion, Andre Churchwell. Dr. Churchwell, before we jump into questions, can you tell us a little bit about what the university is doing to support students, as well as all the members of our community, in terms of helping them navigate during this really critical time and to find a sense of belonging?
Thank you very much, Megan. Appreciate that. Good evening, everybody. Let's all recognize that everyone, whether it be students, faculty, staff, Vanderbilt leaders, have a role in creating a sense of belonging on our campus. It's not owned entirely by our office. The Chancellor has made belonging an important goal for all of us to achieve. The Office of EDI, my Office of Equity, Diversity, and Inclusion, has a huge role, though, because in many cases, the members of our VU community, and for that matter, our national community who are struggling with belonging, are members of minority or underrepresented groups. These are our key stakeholders here. As part of his commitment, the Chancellor's commitment to the concept of belonging, he challenged us to develop a set of metrics or tools to evaluate belonging. We enacted an interdepartmental group, so-called Belonging Measurement Task Force. It's comprised of those offices and groups on campus that have a stake or role in developing belonging programs here at Vanderbilt. It includes the following folks, but there are others that are involved. Vanessa Beasley, our Vice Provost for Academic Affairs and the Dean of Residential Faculty, very much is involved in this. You can imagine from the student's perspective. Ashley Brown, the Director of the Student Center for Social Justice and Identity, has a huge role because of her work in looking at restorative justice practices as well as unconscious bias training. And then there are members from my own Office of Equity, Diversity, and Inclusion who are involved in this. And then Jermaine Soto, Director of Faculty Development from the Office of Faculty Affairs. And there are other key stakeholders who are also involved in our task force. I think it's relevant and important before I delve any deeper that let's define belonging. We hear about it all the time. We spent a deep dive with the task force, almost a whole day, looking at all the different definitions that exist, whether it be in our peer institutions, whether it be in the Oxford English Dictionary, and a whole host of sources. We define belonging here at Vanderbilt as a feeling of support, security, and acceptance of differences. Individuals experiencing belonging when they feel that they matter, are valued, respected, and cared for as members of the community, and which leads to relationships and connections to ensure that each person receives what they need to thrive and fulfill their full potential while here at Vanderbilt. You can almost imagine belonging as being connected to an important philosophical or kind of thought model wheel. That wheel begins with diversity, which we have in spades here in terms of our diverse student body. Then it's connected to community, the creation of a sense of community, that's a welcoming community that knows you personally and accepts you. Then the next part of that wheel is inclusion. That's being supported, being heard, being befriended, being included. And then lastly, if you achieve all of that, then the last part of the wheel is belonging, where you feel needed, you're cared for, and you're present, okay? And you can bring your authentic self to campus every day. The center glue of all of that is mentoring and connecting to our faculty, staff, and students. So it is really an important feature and an important piece of work that we have to do, and we're certainly engaged. Our task force has created a belonging survey tool that will be used to assess belonging twice a year, in the fall and the spring semesters, and will aid and guide us on evaluating the EDI programs that exist across the campus, and will enable us to pivot, adjust, modify, and even delete those programs based on what our survey tools tell us. If I may add a couple of additional key points or tools to consider that we're using to drive this sense of belonging on campus, they would include for certain the Vanderbilt Way, as defined by the Chancellor. Its definition it's about an ethos of belonging for all of our Vanderbilt community. The Vanderbilt Way is based on inclusiveness, quite broad inclusiveness, as reflected by its all-in motto for all of us to support each other, and the One Vanderbilt concept, that we all are here together, we're here growing together, learning together. Its foundation then is built on a foundation of belonging. We're also creating methods and tools for all of the VU community to engage in constructive civil conversations. Nationally and on our campus and across other campuses, we have seen a wave of heated polemics occur when thoughtful exchanges should occur when discussing difficult topics. We must address this. We have a team that is working with my office to create and promulgate these tools. You can't have a shared sense of belonging if you can't respect and accept different points of view from your own. And lastly, the Chancellor and the Provost have merged all EDI work under my office, the Office for Equity, Diversity, and Inclusion. This helps with accountability. The arrows are pointing at me. And it allows my leadership team and I to embed in all our programs the Vanderbilt Way and our belonging strategies under one roof, one office, for all members of the Vanderbilt community, our staff, students, faculty, and when relevant, our alumni. Thank you again for your time, and I look forward to answering questions.
Thank you so much, Vice Chancellor Churchwell, for that great information. And I love thinking about that wheel that you talked about with diversity, community, inclusion, and belonging. I took notes, so I'm excited about the belonging survey. We are going to shift gears a little bit now and talk about some pre-submitted questions, and I will share the questions, and then we will have some of our panelists kind of jump in and answer. So the first question that a student submitted is, how can students access COVID tests with equity when there is a national testing shortage? Is there a price barrier to a population of low-income students with pressure to test to be able to perform necessary campus duties that impact both their finances and education?
So I'll take the first crack at that, and then Dr. Churchwell may want to add some thoughts. But yeah, this is a really legitimate issue in many communities. And we know that, one of the tragedies of COVID is the health inequities that have been associated with it, for particularly our vulnerable populations. So, we know this is an issue for many. Again, the fortunate thing is that we have free testing available here for all of our students. And so students have ready access to that. If they can't get a test in their own community, we can do it here for them. I'll let Dr. Churchwell add to that.
Thanks, Pam. As part of my other duties, I'm professor of medicine in the medical school and the medical center in cardiology. So in my other life, I had worked with Pam on issues around health disparities within our Nashville community. I want you to turn to our EDI webpage, because last year we did 2 COVID webinars as informational webinars that address exactly the points that Pam had made. COVID has shined a bright spotlight on existing health disparities and the health disparities around COVID and access to testing and treatment. Our vulnerable populations, which are generally our minority populations, people of color, African American, Native American, Latinx, and the like, have seen a real challenge in the beginning of this pandemic in terms of getting tests to determine if they have the problem. And this was an issue that we see that reflects the social determinants of health, the lack of access to healthcare, the issues about being away from medical centers and away from clinics, the issues around poverty and education. Then we've actually seen the fact that the mere fact of being a minority in this country, particularly African American, Native American, Latinx, you're under higher psychosocial stresses So we wrote a paper last year in the New England Journal Catalyst journal that made the case that the psychosocial stresses that minoritized communities face increase their susceptibility for COVID infections. Their immune systems aren't quite as revved up, being under a chronic state of stress. So we do see higher rates of COVID in our African American, Latinx, Native American populations and our other minority communities. And sadly enough, we do see also higher mortality. So if your immune system is not as effective, you wind up with more morbidity and more death. If we look at the African American community across the country, whether it be in Nashville, Memphis, or Los Angeles, you'll see twice the rate of mortality of death compared to their white counterparts. Similarly, Hispanic, about twice in terms of mortality. And the worst mortality we have seen, unfortunately, is out west in our indigenous communities. Our Native American communities can have 3 times the rate of mortality compared to their white counterparts. And think about the issues of access to care and poverty and lack of education, all the things that lead to these huge disparities that we see. But thank goodness here at Vanderbilt, everybody has access to testing. It's important. Thank you.
Great, thank you so much. So the next question might be for either Pam or Professor Olatunji. And why is it necessary for graduate and professional students who have very different schedules and responsibilities than undergraduate students to participate in the Commodore's care period? And someone just submitted a question about if students, graduate and professional students, have either off-campus jobs or classes they're not taking at Vanderbilt, are they allowed to go to those right now too?
Well, I'll start and then you might want to add to it. So as I said, we know that there's a significant number of cases in our graduate and professional students. So we know that from the data that we already have. We know from contact tracing activities over the past almost 2 years now that we have seen a number of clusters within the graduate and professional schools. And those are usually things that are quite well-meaning, like people getting together for study groups and people, having a dinner kind of situation. And even with a vaccinated population last fall, when we returned to campus, we saw a large cluster in one of the professional schools from everybody going out and, enjoying being back on campus together. So as much as we hate it, that we can't do those kind of things, we just can't do them right now. So the graduate and professional schools, undergraduates and residential housing has its own set of risk factors, but the graduate and professional students absolutely have similar risk factors. And I would argue maybe even higher because you have more interaction with the community around us, and the vaccination rates continue to be really low in our community.
Yeah, I don't really have much to add to that. That was eloquently put. I mean, I think that the way that I sort of conceptualize this in some respects is really think about the notion of one Vanderbilt, and we all have different risk that we bring to the table in terms of the people that we're in contact with, and so really in trying to protect everyone, this is really the most parsimonious approach, is to kind of put our undergraduate and graduate population under that umbrella, because those populations are interacting, as Pam alluded to, the different folks that are sort of accumulating in the heightened risk. And so I think that we want to be careful and mindful of protecting, again, the most vulnerable upon us. And then that's going to require us to, really woggle down and at least for the time being, and sort of try to be as compliant as possible.
Megan, there was that one other question that I didn't answer, which is absolutely, if you have a job or other classes that you go to, go to those things. I mean, we need to use some common sense with this as well. And I'll add one other thing, because I know it bubbled up as a hot topic earlier in the week, and that is the rec center. The rec center is open for individual workout activities. And there were some students who were concerned about that because it seemed counterintuitive given the other restrictions. But we know that that exercise is so important to the mental health of our students. So we've socially distanced in there as much as possible. Masks are required, but given the season, and I think we may get snow this weekend again, we needed an option for people to be able to participate in individual exercise, not group activities, but individual.
Wonderful. Thanks, Pam. I am going to follow up with one more that I think might be in your area. So we have received some questions from students who have recently tested positive. What's the protocol for those who have a positive test, either during pre-arrival testing or regular testing, but have passed the recommended isolation time?
So that's a great question. And there's a web form on the homepage for the health and safety protocols. It's in the upper right-hand corner. I know exactly where it is. And you just need to click on it and fill that out. And we have some processes in the background. It'll automatically calculate if you're out of your isolation period, and you'll get a notice by email that says you're out, you're cleared to come to campus. But it's really important that you submit that, because that's how we exclude you from any testing requirements. We don't want you testing within 90 days because you're very likely to test positive again, and that creates a whole different set of problems. So please go to the website, submit your test. Even if it's a home test, it's fine. Just take a picture of it and send it to us. And we've had a few students who said, I didn't know that, I threw my test out. Then give us all the details, including the date and when you tested, and we'll accept that as well.
Great, thank you, Pam. One question that folks have is, what academic accommodations will be made for students who need to isolate or cannot attend class because of COVID?
So I can speak to that a little bit, and I think that this is something that the graduate school is particularly sensitive to. And although this is not something that we were able to do as a matter of policy, in large part because we are sort of focusing on this in-person learning experience as our sort of path forward. The message has been to faculty to be flexible, and I think our faculty are especially mindful that that's going to be important for graduate students, that we offer some degree of flexibility. That being said, I think along those lines, if there's students who require certain accommodations, there are processes in place for students to request set accommodations, and I would strongly encourage students to take advantage of that resource. Those accommodations can be submitted, and they're vetted and reviewed, and a decision is rendered. But I think that sort of the meta message is this idea that we recognize that there is going to be a need for some flexibility in order for this to work moving forward, and I think the faculty are hearing that message.
Great, thank you so much. Another question is about in-person meetings in January. And the question is, can we host in-person gatherings on campus in January with research participants from outside the Vanderbilt community?
I'll take a crack at that. I think the issue is to work with the PI in the individual study and determine what are the current protocols that are in place with that. And I'm not 100% familiar with all of those protocols right now, but I would strongly encourage them to reach out to to their PI and talk that through. And then additional direction can be received from the leadership in the research area.
Thank you, Pam. Another one, Pam, that you might field is, what are the university's plans for monitoring any surge in infections due to potential student travel during spring break?
Well, that'll be a fun time, won't it? We are ready with the same processes that we use in terms of our testing protocols, our contact tracing, our command center overview of the data that we have. So we'll be watching that. We are very hopeful that this particular surge is going to have been well past by then. And we don't know, and we don't know what the next variant will bring, but just like we've done for the entire time, we're going to take it one step at a time. And we know how important that spring break is for people. So we're going to just keep a really close eye on things and be as facile as we can.
Great. And then this, I think, is an easy one. Do graduate and professional students need an appointment to get tested on campus?
No, it's walk in, check the hours on the website. The testing hours are included. And for people who need testing next week, we did open the testing center on MLK Day. We didn't want to because we really wanted to fully respect that holiday, but we had to because of just the circumstances of people coming back and pushing our start date back a week. So it is open on the holiday, and you know, check those hours out and just walk in and get tested.
Wonderful. And I've talked to a couple folks who have done it, and it's a quick process, and so that's a good thing. Very efficient. So this question just came in. Are there resources for graduate and professional students who are balancing shifting childcare needs during the pandemic, such as those that might have young children who are isolating at home?
That's a good question. You know, the child care centers themselves are having some struggles because of the cases. And so I don't have a great answer for that question. I think that university leaders are always cognizant of that, but many child care areas are really struggling right now. And of course, with kids who are in the ages where they haven't been vaccinated, are unable to be vaccinated, they're very likely to get exposed at school. So I wish I had a perfect answer for that, Megan, and I just do not.
Yeah, it's a complex issue. I know several people that are managing that. So one other question that I'm looking at, and this was pre-submitted, is canceling spring break and/or instituting an in-semester reading days with no class or assigned work something the university is currently considering?
Well, I was asked this last night, so I'll answer it again. I never say never with COVID. You know, every time we think we have everything figured out, it takes a little turn on us and we have to be flexible. But right now, everything is being done to, again, try to get case counts under control so we don't have to do anything draconian. And spring break is pretty sacred at this point in time. So we will do everything we can to preserve that.
Great. I know that many students will be happy to know that they'll have a week of rest if that all works out. That's great. I am going to ask if folks have any other questions. Please feel free to submit them. We've kind of made our way through, I think, all of the questions that have just been submitted, both before the webinar and currently. So I'll just give people a minute or two and see if there's any additional ones that come in. And if any of the panelists would like to add anything, you could feel free to. Seems pretty quiet. Might give you all 10 minutes back to your evening. Well, I just want to say, and I'm still kind of watching the chat if a question comes in, but we really appreciate all the panelists being on here and sharing your wisdom and expertise and thoughts and ideas with us tonight. We're at the end of our time together. And my special thanks to everyone that submitted the questions and interacted with us and that showed up tonight to be here with us. We're keeping a record of any questions that didn't get answered today so that they can be addressed on the Health and Safety Protocols website. And there will be a recording of this town hall that will be available for later viewing if you want to refer back to it, or if some of your friends didn't get a chance to watch it, they can watch the recording. Sincere thanks again to our panelists for being here, and thank you all so much for attending. This concludes our town hall, and I hope you all have a great evening.